Well, all new for you at 6:30. We're focusing on a serious chronic disease that's on the rise. According to the CDC, more than 40% of Americans have obesity, traditionally defined as a body mass index of 30 or greater, and associated with a greater risk of heart disease, type 2 diabetes, and certain cancers. Doctors say we need to change the way we talk about and treat obesity. Too many people have repeatedly tried to lose the weight and keep it off, only to fail and face stigma and shame. And that is why Amanda Kaiser says she is sharing her story. The Illyria mom tells me she wanted to feel good and live well and wanted to encourage others. She says if she can do it, you can too.
Don't dare.
I don't wanna.
Amanda Kaiser is a busy mom
Buddy?
of 2 boys,
High five.
working a high-stress job in children's services.
Caregivers typically don't take care of themselves.
She gave 110% to everyone but herself.
I've got you.
So when did you finally say, okay, enough is enough. I'm going to feel good. I deserve to feel good.
It was last year. I was playing with my kids and my knees just hurt. And I'm in my 30s. My knees shouldn't hurt. I shouldn't be out of breath. And I stepped on the scale and I was like, oh my God, I've let this get so far out of control.
Weight, Amanda says, had controlled much of her life, dieting since she was
About 10 or 11 years old, trying everything.
everything, she says, except medical help. She'd been reluctant to visit a doctor.
I was like, okay, they're just gonna look at me and tell me I lack my willpower and that I just need to stop being fat. I was prepared for that. I was going in there like, okay, I'm just going to leave crying. And I didn't.
Instead, Amanda says a visit to certified obesity medicine Dr. Rena Bose at the Cleveland Clinic changed her life.
There needs to be more of an awareness, not just by patients, by the primary care docs, that this is a disease state. It's not something that is a choice by the patient. It's not the patient's fault.
Dr. Bose says obesity is a chronic and preventable disease that's treatable.
We have great medications now because we can identify the pathways that's causing us to become obese. And altering those gut and brain pathways, altering your disordered eating, altering your behavior, getting that kind of guidance and help can really impact how we manage obesity.
But I like weightlifting more.
Managing obesity, she says, is multifaceted. For Amanda, it meant working with specialists to learn about nutrition, portions, and exercise, and medication to help control appetite while learning these new behaviors.
And it was just so relieving to hear a medical professional say it's not totally your fault and I'm just going to help you and not make you feel terrible.
Another important part of managing obesity, says Dr. Bose, is something Amanda had already started: therapy. Amanda says it helped her see she was using food to treat trauma.
Did you ever feel like you would get to this point where you really did feel good?
No. I thought feeling like crap was like the normal thing.
Her new normal? Feeling hopeful. She's almost 60 pounds down, maintained and counting, something she says has never happened.
Is it about the scale, though, for you and what it says?
No, I want my body to be able to do what I want it to do and go where I want it to go. And being healthy and being around for my kids. And showing them a good way to grow up.
All right, so let's talk about the anti-obesity medication for just a minute, because it's a really big part of this. It's important. Dr. Bose says they are safe and effective. She says the newer approved meds are getting close now to 15 to 20% weight loss over 6 months or longer. That's compared to the older ones at around 5 to 10%. The amount of time you're on these medications varies. Same for the amount you pay for them. Insurance does not universally cover anti-obesity medication. Dr. Bose says the monthly cost can range anywhere from like $10 upwards to $1,000. She says doctors can try to work around that, but she's really hoping that this changes soon. So I did reach out to the Ohio Association of Health Plans. They sent me a statement saying, in part, Ohio health plans cover both prevention and treatments for obesity in a variety of ways. Continuing on, they say they're constantly monitoring the effectiveness of drugs as they gain FDA approval, including potential anti-obesity medications. So it really is a crucial part of treating obesity, she says, and it's very frustrating for providers when they run into this for people who cannot afford some of these medications. But she says she's just really hopeful that as they're out there longer and proving how effective and safe that they are, that, you know, they'll gain more traction and get more coverage.
What stood out to me in that piece was, one, this is a woman that, first of all, she's beautiful, but thought she wasn't beautiful, and she felt that had to be her lifelong sentence.
And it doesn't,
was to
right.
be this way, and it doesn't have to be that way.
Right. And she found a doctor who really understood her, cared for her, and she felt so totally cared for too. So that's really crucial.
Great information.
Hope is out there and help is out there too. Yeah.